Thank you very much for those presentations. I like the slide on Annie in particular. So questions for this panel, discussion for this panel. Cindy.
Thanks, George. I wanted to address mostly the professional education in medical and other health profession schools. And one of the problems that you, Barbara, had mentioned was the lack of faculty kind of being with the program. And so, a number of us around the table have worked on creating or funding continuing medical education courses, maintenance of certification courses. Is there something else that we should be doing to help bring those folks around? And then the second part of my question, asks the question of whether curricula modules might be helpful. And I'm thinking about that in a couple of ways. One is there's an effort that's being made to gain some consensus about health literacy competencies. So this is out of work that Cliff Coleman and Stan Hudson are doing, where they already polled deans of all of the various health profession schools and came out with a huge consensus that yes, and what they called competencies ranged from documenting teach back to universal health literacy precautions. So a wide range of things that they're now trying to consolidate and prioritize. But I asked particularly about curriculum modules because one of the things when ARC did work in pharmacy health literacy was we discovered that the people who were picking up some of our tools were actually the pharmacy colleges, and decided to develop modules that could kind of be plug and play. The idea that can we make this easier for educators to incorporate it into their curriculum. So two pieces of that.
So you have a number of issues there. I think I did read that paper on those competencies. The number of competencies spans like 4 pages. Okay, and they range all over the place, from every competency in cultural competency to every competency in communication. So,
different paper, but I know which one you're talking about.
Yeah, and then maybe it's a different paper. So, I think people do need to figure out where are all the competencies in communication and cultural competency, and where are health literacy. I think modules are okay, but again, if you do a module, you ask a student to do a module, particularly online, it's gone. You don't learn from that. You don't input it from that. So you need to have the pharmacists who are watching the students as they relate to the patients have enough skill to say, you did that really well, or I like the way, but did you pick up in the way they look? So,
right.
So it's a different level of just, module
right, and
delivery.
I'm not talking about, for that, an online module. A lot of the CME and MOC stuff are that lines, but I'm thinking more like exercises or ways to evaluate your residents, or, what are the tools that we can provide is basically the question.
Right, and it's always great to provide tools so that people don't have to recreate the wheel. Okay, I think those are all very useful for people. And then it's getting them to write the competency. If it doesn't become a competency for their program, then it doesn't get counted and it doesn't get done. So they're really responsible for that, and any pressure that can be put on. We have lots of competencies, so it is a tough world out there. And that's why we try to really integrate it so it doesn't seem like it's an extra. It's just part of what it needs to be.
So, borrowing this slide, seems like listening to your conversation or your discussion, Barbara, the different professions as you went through the standards, seems like that lower part of the body from the neck down ought to be actually divided into a number of pieces as well. I missed the point there. So as you went through and described how each of the professions is grappling with how to incorporate these principles into their standards. So I'm impressed that with that variation and that difference, it must be a little hard for the professionals to come together with the same sense or not. And I really don't know if that's the case. And so I'm wondering, one, how much of a challenge that is for us, that sort of difference. And then secondly, if you have any thoughts about what we can do about it.
Well, actually, this morning as I was sitting here listening to everybody and thinking about that question that might get posed, and thinking about IPE, which those of us who run schools of nursing or schools of medicine or schools of pharmacy, et cetera, know that it has been dropped on us.
Got it.
It is a will do, that maybe health literacy ought to be the way we do it. Okay? And I thought, wow, I'm taking that right back as I thought about that this morning as we're about to figure out how to do this and do it in role so that we can both see each other doing it. I mean, I think that there may be a real opportunity there actually for us to do that together.
Quick clarification, there are some of us who don't recognize that particular acronym.
Sorry, my apologies. It's interprofessional education. So
That I recognize.
Yeah. Then they're going to add the librarians to that very soon.
Okay, I didn't see who was next, so we'll go right over here, and then we'll come over.
Thank you for some wonderful presentations, it must be said. This is for Lindsay, and this may seem like a very elementary question, but it continues to cause confusion in the presentations that I give on health literacy, both in my organization and externally. And it's the term oral health literacy, oral as in dental and mouth versus oral verbal and communication. And
That's a good point.
has there been any discussion from the ADA or
Yes.
others about perhaps changing that? I know that you're involved with more than just teeth, but for clear communication purposes, I wonder if there was any consideration about dental health literacy, and that might resonate quicker for a larger population.
Well, in fact, and Alice, you were part of the early conversation. She's been on the advisory committee for the entire time. I mean, she's just a huge historical perspective. But the advisory committee recently changed their name to the National Advisory Committee on Health Literacy in Dentistry. And in hearing Dr. Pasha-Orlow's, it was your presentation, who offered a different version of OHL, organizational health literacy. So we've got a lot of acronyms, or somebody on the, oh yes, okay, Dr. Rothman. We've got so many acronyms out there, and that would probably be more, it would probably resonate better and make it more, really more encompassing, because dentists, we want to be thought of within the spectrum of health literacy, not standing by yourself siloed as oral health literacy. So that's a good point.
Excellent. Right over here.
Yes, Steve Rush, United Health Group. I thought the three presentations were really outstanding, and I'd like to thank Rima for providing several frameworks to create a business case that I can take back and share with the folks in my organization that need to know. As a psychologist, I'm thrilled that health literacy, plain language is interwoven in clear communications in Barbara's curriculum. And we too had issues with the concept of oral health literacy versus health literacy in the spoken word. Mike Weitzner, who's a dentist for United, and I have had some very interesting discussions on that. What I wanted to do is to share that, Lindsay, as you were going through your presentation and talking about the IOM Roundtable on oral health literacy, following that, we've worked with Temple University, and Dr. Ishmael talked about a project, and we've been engaged with that. And from a business case standpoint, Mike Weitzner has done some really great research that showed the relationship between oral health, dental health, and medical care. And one of these days we'll get it published, but you could see how the integration of all these things are really very important, and I'd like to thank all for your presentation today.
Okay, we'll go over here to Wilma.
Hi, Wilma Alvarado Little, Roundtable member. I just want to say yes, thank you to all the presenters. It was a wonderful job. My question is to Barbara, and I want to apologize if my question's really basic, but I'd like to know as a patient regarding the ACGME core program requirements. I'd like to know from a patient perspective, how will I have the sense that, that the resident did this part successfully, are expected to communicate effectively with patients, families, and the public as appropriate across a broad range of socioeconomic and cultural backgrounds. What does that look like?
I think from the patient's point of view, the patient goes home knowing and having communicated with that care provider, with that physician or resident in the room, okay, or medical student. They know what they're supposed to do. They know how to do it. They feel good in that they've had their opportunity to ask the questions that they needed to ask. I think the harder part is, the unfortunate part is the patient often doesn't tell us that they didn't understand. They're confused. They're going home not knowing. So it's how does the physician or the physician in training understand that they did or did not communicate appropriately. So if they're good at their nonverbals, they can easily tell from how you're looking and relating that you may or may not be understanding. They also may not be that good, okay, especially at the beginning. And when you come back, do they ask you the kinds of questions they need to see whether or not have you been taking your medications? They're really going back to the simple, direct communication skills that everybody needs to learn, and then learning some of these other skills like teach back. So if they find that they haven't been communicating well with a patient, to begin to make sure they always use that technique before the patient leaves. I find that, teaching how to use a translator is very important, but we have to remember we still have to use health literacy skills even through the translator, and that's why I think we have this Venn diagram that overlaps and makes some of this general talk about communication different.
This is just me being the lone interpreter in the room. Interpreting is the oral communication and translation is the written communication. So when you say translator, which one are you referring?
My interpreter. My apologies. I would use interpreter in the room. Yeah.
Okay, terrific. I want to thank this panel not only for the astute. Well, we have a hand back there. Yes, please. Well, you need to come to a microphone.
You're on the record now.
Because we're recording this, so we need to get you actually on the record here.
Okay. My name is Sabrina Kurtz-Rossi, and I'm an assistant professor at Tufts University School of Medicine. And so my classes are interprofessional, dental students, nutrition students, pre-med students. But what I wanted to say is oral health has done a great job in incorporating these competencies and taking on health literacy. Nursing schools have, so there seems to be a pharmacy as well. But there's so many health professions out there, public health professionals, that they also have competencies, they're communication competencies. But there are so many professions. So how do we it seems exhausting getting objectives or competencies even, maybe all these health professions have standards, because, I don't know each profession, but maybe their standards are written, because it sounds like these standards are written, but it's really up to the medical school or the professional school to write their own competencies, which could very well be health literacy competencies. Have we done it because the standards are around communication and we really just need to figure out how to get health how that gets down to the medical school or the professional school? And the other thing is, that seems exhausting. How can we get to all these health profession schools? Yeah, that's my question. Oh, I do have another follow-up question, but let's start with this.
We'll see if we have time for it.
If we have time.
Let's chew on this one first.
I think you need champions. Okay, champions with enough gravitas. okay, to get some pretty difficult and complex work done. And I think that if you did that together with colleagues, it might have more effect.
I would agree with that, identifying, and sometimes it's nurturing the champions. I mean, Alice has been one of my significant mentors in my life, and she's really, she's helped me every step along the way to succeed in the best way I can do for the dental profession. And in terms of champions at Tufts, do you know Nicole Holland?
Oh, they do great work.
Yeah,
we want to
she-
start a
Yes.
working group at Tufts because it's
Yeah.
in dental. They have a health literacy
Yes.
project going. It's in pediatrics. They're now
Yeah.
doing a quality improvement program. It's in public
Yeah.
health.
So
But we didn't know each other was doing this work, so.
let's make sure we just respond to the question here, because we have limited time. Go ahead.
I know that people are loath to be too simplistic, especially with competencies. You know, people like generating lists of 50 competencies. But it might be possible, if we can establish a dialogue, to get just one or two competencies as a starting point that every professional organization and group needs to abide by. And perhaps we might start with issues, and you gave that very good example, of using everyday talk, of using plain language and following it up with a check on the teach-back method. So if we started with just those two very simple competencies to get all organizations to abide by that, that's a starting point. We very often are uncomfortable with that because that doesn't define who we are, just those two. But it's a starting point. And if we think about it along those lines, there's a potential there for us to work.
I would also add comment, which is an excellent question, the continued professionalization of modern society, healthcare in particular, and the continual fragmentation of training and the self-organization of professions in different silos really creates a problem of how you get consistency, particularly when those people need to come together again in teams to operate in these new, now consolidating systems that compose all of these professionals. It places more of a burden after the formal education on the operating environments to make sure that all the team members from the different professions have consistent training and approach to the patients. And it also is a particular opportunity for those organizations to make demands to the different professions in terms of what they need in terms of prepared professionals. And that's more of a factor now than it was when professionals went out and were in their own practices. So that's another dynamic that your question raises. If your second question is very brief, I'll allow it, but we need to actually move on with the agenda.
Okay. So one, just in response to this, that what Cliff and Stan are doing is actually trying to come up with a few competencies like you were suggesting, Rima, and they are actually doing a prioritization activity that all members of the Roundtable here are invited to participate. So if you have not heard about this and are willing to spend a few minutes on the prioritization, I will get you in touch with them. My quick question to ask and impossible to answer question is that we've been talking about training individuals, but we spent the morning and the last 5 years or 10 years talking about how important the systems are.
Right.
And where does the education for the people who are the leaders of our healthcare systems happen, and what are the entrees to educate them into becoming health literate organizations?
Yeah, and that's another excellent point, because that usually falls outside of the spectrum of the usual professional schools. What's your last question, very briefly?
This was for Rima, saying that adult education now is just, there's no funding. So how do we should we just switch our attention to K through 12 in terms of raising the health literacy of the nation? Focusing on the health literacy skills of the community.
It's very, very difficult in these very trying times. Agricultural extension workers are also facing sequestration and cuts. So the informal network and the informal system is falling by the wayside. And I think it really just takes political activism and action on our part to articulate that. It's such a crucial issue. And yet it's so sad to watch. I wish I had an answer to that question.
That's an excellent response, and I'm not so sure that we should be giving up on adult education, but we
Right.
should be
Oh,
figuring out how
absolutely
to
not.
change the dynamic. I'd like to go further, but I think that at this point we need to break. We're going to change the agenda a bit. We've got something different planned for after the break. I've been made aware that it's going to be something different. And so we are going to take a break now for 15 minutes rather than hear the panel, and then we are going to have you reassemble in 15 minutes at by my watch 25 minutes to the hour for something different. Okay.